One of the most common mistakes I see women over 50 make when trying to fix hair thinning is eating more of the foods they've been told are healthy, and nuts are one of the biggest offenders. So today I want to slow this conversation down and approach it the way we do in dermatology with biology, context, and evidence. Because hair loss in midlife is not about a single food being good or bad. It's about how nutrients interact with the hair follicle, the scalp environment, inflammation, hormones, and overall metabolic health. Hair follicles are among the most metabolically active structures in the body. They require adequate protein, micronutrients like zinc and iron, essential fatty acids, and a relatively low inflammatory environment to function optimally. But they're also extremely sensitive to imbalance. Too little of a nutrient can impair growth, and too much or the wrong form can actually push hair into shedding. This is something we see clinically, especially with supplements and restrictive diets. Nuts are a great example. They're often labeled as superfoods, but they're also calorie dense, allergenic for some people, high in certain fatty acids, and in excess capable of contributing to inflammation or nutrient competition. So the question isn't which nuts regrow hair, but rather which nuts support the biology of the hair follicle and in what amounts. Another reason this topic matters is that women over 50 are already navigating hormonal shifts, changes in insulin sensitivity, and increased susceptibility to chronic low-grade inflammation, all of which affect hair cycling. If we oversimplify nutrition advice, we can unintentionally worsen shedding, scalp irritation, or even nutritional deficiencies. So in this video, I'm going to walk you through 4 nuts that can support healthy hair growth when eaten appropriately, and 4 that in certain contexts may contribute to hair shedding or scalp issues. This is not about fear, restriction, or miracle foods. It's about understanding mechanisms, moderation, and consistency. Hey guys, welcome back. If you're interested in evidence-based skincare and learning how your skin actually works, you're in the right place. If you're new here, I'm a board-certified dermatologist, and this channel is all about practical, science-backed skincare. If this video is helpful, consider giving it a thumbs up and subscribing. Let me know in the comments where you're watching from. Now, let's talk about why nutrition, and specifically nuts, is something your hair and scalp actually care about. Hair growth follows a cycle, an active growth phase called anagen, a brief transition phase, and a resting or shedding phase called telogen. In younger adults, most scalp hairs are in anagen, which can last several years. After 50, that balance shifts. Anagen shortens, more follicles enter telogen, and the hair shaft diameter gradually miniaturizes. This is well described in studies on female pattern hair loss and age-related alopecia, published in journals like the Journal of Investigative Dermatology and Dermatologic Clinics. What's important here is that the hair follicle is not passive. It's a highly active structure with a significant energy demand. It relies on adequate protein, iron, zinc, B vitamins, and essential fatty acids to maintain growth. When intake is insufficient or imbalanced, follicles interpret that as a stress signal and shift into shedding. This is why hair loss often appears 3 to 4 months after a dietary change, illness, or weight loss. Have you ever noticed hair shedding months after a stressful event and wondered why it didn't happen right away? After menopause, changes in estrogen reduce blood flow and growth, signaling to the follicle. At the same time, insulin sensitivity often declines, and low-grade inflammation becomes more common. Together, these factors make follicles more vulnerable to inflammatory triggers, including dietary ones. This doesn't mean food causes hair loss directly, but it can modulate the environment in which follicles are trying to grow. Think of the scalp like soil. The follicle is the plant. Nutrients don't force growth. They create conditions that either support or impair it. If the soil is inflamed, compacted, or nutrient imbalanced, the plant struggles no matter how good the seed is. This is where nuts come into the conversation. Nuts are calorie-dense, fat-rich foods that deliver minerals like zinc, selenium, magnesium, and copper, as well as fatty acids that influence inflammation. But they also vary widely in their omega-6 content, allergenic potential, and phytochemical load. For some people, they're supportive. For others, especially in excess, they can quietly contribute to scalp inflammation or nutrient competition. In clinic, I see women who dramatically increase nuts because they're told they're good for hair, only to develop increased shedding months later. Not because nuts are bad, but because the dose, balance, and overall dietary context weren't considered. A practical takeaway here is moderation and diversity. No single food should dominate your diet for hair health. Aim for small portions, think a closed handful, and rotate sources of fats and minerals. If you're dealing with unexplained shedding, it's reasonable to review not just what you've added to your diet, but how much. Now, we'll go nut by nut, starting with those that tend to support hair biology when consumed appropriately, and then those that may contribute to hair fall in susceptible individuals. Let me know if you've ever noticed changes in your hair after a dietary shift. That awareness is often the first step toward understanding what your scalp is responding to. When we talk about foods that support hair growth, what we're really talking about is whether they help maintain the follicle in the anagen or growth phase, and whether they reduce inflammatory signaling around the follicle. Two nuts that tend to do this well when eaten in appropriate amounts are almonds and walnuts. Almonds are a reliable source of vitamin E, magnesium, and small amounts of biotin. Vitamin E is particularly interesting from a dermatologic standpoint. It functions as a lipid-soluble antioxidant, helping protect cell membranes, including those in the hair follicle, from oxidative stress. Oxidative stress increases with age and has been shown in several observational studies to correlate with hair thinning and premature follicle aging. Vitamin E doesn't regrow hair, but it helps preserve the environment that follicles need to function. Magnesium also plays a role in protein synthesis and cellular energy metabolism. Hair follicles are rapidly dividing structures, so anything that supports efficient energy use is helpful. Clinically, I often see marginal magnesium intake in women who restrict calories or avoid whole foods. Almonds can help fill that gap, but portion size matters. A small handful, about 10 to 12 almonds, a few times per week is sufficient. More is not better, and excess intake can crowd out other nutrients. Walnuts are unique among nuts because they contain alpha-linolenic acid, or ALA, a plant-based omega-3 fatty acid. Omega-3s are well studied for their anti-inflammatory effects on skin and hair. They help modulate prostaglandins and cytokines that influence the hair cycle. In inflammatory scalp conditions, even subtle ones that don't cause itching or redness. Omega-3 intake has been associated with improved hair density in small clinical trials. Think of inflammation like static noise around a radio signal. The follicle's growth signals are the music. Omega-3s don't turn the volume up, they reduce the static so the signal can be heard more clearly. Another benefit of walnuts is their copper content. Copper is required for melanin production and cross-linking of keratin fibers. Very low copper levels can contribute to brittle hair and changes in pigmentation. That said, copper is a double-edged sword. Excessive intake can be pro-oxidant, so again, moderation is key. 1 ounce of walnuts a few times per week is more than enough. A practical way to include these nuts is to treat them as accents rather than staples. Add sliced almonds to oatmeal or yogurt, or a few walnuts to a salad. Avoid grazing mindlessly from a bag, which makes portion control difficult. If you're allergic to nuts or have gastrointestinal issues, these are not mandatory foods. The nutrients they provide can be obtained elsewhere. And if you're experiencing significant hair loss, food alone is not a treatment, it's supportive care. 2 other nuts that can support hair health in women over 50, again, in the right context and amounts, are Brazil nuts and pistachios. These come up less often in hair conversations, but from a dermatologic nutrition standpoint, they're worth understanding. Brazil nuts are one of the richest dietary sources of selenium. Selenium is a trace mineral that plays a role in antioxidant defense systems, particularly glutathione peroxidase, which protects cells from oxidative damage. Hair follicles are sensitive to oxidative stress, and selenium deficiency has been associated with diffuse hair shedding in several clinical observations. That said, selenium has a very narrow therapeutic window. Too little can impair hair growth, but too much can cause hair loss. This is something we see in clinic with supplements and overconsumption. Symptoms of selenium excess include brittle hair, increased shedding, nail changes, and gastrointestinal upset. 1 Brazil nut can contain anywhere from 60 to over 90 micrograms of selenium, depending on the soil it was grown in. The recommended daily allowance for selenium in adults is around 55 micrograms. So the practical advice here is very specific: one Brazil nut, 1 to 2 times per week. Not a handful, not daily. Used this way, it can help support antioxidant defenses without risking toxicity. Pistachios are another nut that can be beneficial. They contain plant protein, potassium, vitamin B6, and carotenoids like lutein. Vitamin B6 is involved in amino acid metabolism and hemoglobin production, both relevant to hair growth. Adequate oxygen delivery to the follicle is essential for maintaining anagen. Pistachios also have a lower omega-6 to omega-3 ratio compared to some other nuts, which may make them more neutral from an inflammatory standpoint. They're also less calorie dense per nut, which can help with portion control. From a practical standpoint, a small handful of pistachios a few times per week can be a reasonable addition to a balanced diet. Choose unsalted varieties when possible, especially if you have hypertension or are sensitive to sodium. At this point, you may be noticing a pattern. The nuts that tend to be supportive for hair are those that provide antioxidants, trace minerals, or anti-inflammatory fatty acids without overwhelming the system when consumed in moderation. Now, it's important to shift gears because there are also nuts that in certain individuals or patterns of intake may contribute to hair shedding, not because they're inherently harmful, but because of how they affect inflammation, hormones, or nutrient balance. Now we're switching to the nuts that can cause problems in certain contexts, may contribute to increased hair shedding, especially in women over 50 who are already dealing with hormonal shifts or inflammatory scalp conditions. This is not about labeling foods as bad, but about understanding how excess or imbalance can affect hair biology. The first is peanuts. Botanically, peanuts are legumes, not nuts, but nutritionally, they're often grouped together. Peanuts are very high in omega-6 fatty acids. Omega-6 fats are not inherently harmful. We need them, but when intake is disproportionately high relative to omega-3s, they can promote pro-inflammatory pathways. Chronic low-grade inflammation is a well-recognized contributor to telogen effluvium and can exacerbate female pattern hair loss. In dermatology, we often see scalp inflammation that isn't obvious, no redness, no flaking, no itching, but is still enough to disrupt the hair cycle. Diets heavy in omega-6 rich foods can quietly contribute to that background inflammation. If peanuts are a daily staple, peanut butter every morning, peanut snacks throughout the day, that balance can tip unfavorably. Another issue with peanuts is allergenicity. Even without a classic allergy, some people have sensitivities that manifest as subtle inflammatory responses. Have you ever noticed scalp tenderness or itching without a rash? That's sometimes a clue that inflammation is present even when the skin looks normal. The second nut to approach with caution is cashews. Cashews are relatively high in omega-6 fats and also contain compounds that can be irritating for some individuals. In people with sensitive skin or inflammatory conditions like eczema or seborrheic dermatitis, cashews may worsen systemic inflammation when eaten frequently. Cashews are also easy to overeat. They're soft, palatable, and often consumed in large quantities. From a metabolic standpoint, excess calorie intake, especially from fat-dense foods, can worsen insulin resistance over time. Insulin resistance has been linked to androgen-mediated hair thinning in women, particularly around the crown. Think of hair follicles like a thermostat. They're sensitive to internal signals, hormones, nutrients, inflammatory mediators. When those signals skew towards stress or imbalance, the follicle responds by shedding rather than growing. If you enjoy peanuts or cashews, the takeaway is not avoidance, but awareness. Rotate them rather than relying on them daily, and balance them with omega-3 rich foods like fatty fish, flaxseed, or walnuts. Two other nuts that can contribute to hair shedding in certain people, particularly when consumed frequently or in large amounts, are pine nuts and excessive mixed nut blends. These are less commonly discussed, but clinically they come up more often than you might expect. Let's start with pine nuts. Pine nuts are rich in omega-6 fatty acids and are also quite high in calories relative to their size. From a dermatologic perspective, the concern is not toxicity, but cumulative inflammatory load. In women over 50, the scalp is often more reactive due to age-related barrier changes, reduced sebum production, and altered immune signaling. Diets that lean heavily toward omega-6 dominant fats can amplify inflammatory mediators that influence the hair cycle. There's also an interesting phenomenon known as pine nut syndrome, where some individuals experience taste disturbances after consumption. While this is not directly linked to hair loss, it highlights that pine nuts can have systemic effects in susceptible individuals. When a food consistently produces unusual systemic symptoms, it's reasonable to question how it may be affecting other sensitive tissues, including the scalp. Now, let's talk about mixed nut blends. These are often marketed as health foods, but from a clinical standpoint, they can be problematic for hair health, not because of a single ingredient, but because of quantity and lack of balance. Mixed nuts often combine peanuts, cashews, almonds, oils, salt, and sometimes added sugars. It becomes very easy to consume several servings without realizing it. This matters because excess intake of nuts can displace other important nutrients. Hair follicles need iron, zinc, iodine, protein, and certain vitamins that are not abundant in nuts. If nuts crowd out lean protein, vegetables, or whole grains, you can end up with relative deficiencies even in the setting of adequate calories. There's also the issue of copper and zinc balance. Many nuts contain copper, while zinc intake may remain marginal. Excess copper relative to zinc has been hypothesized to contribute to hair shedding in some individuals, although data here are limited. Still, we know from basic biology that mineral balance matters. A helpful analogy is to think of nutrition like an orchestra. Each nutrient has a role. If one section gets too loud, the music becomes distorted. Hair growth depends on harmony, not dominance. If you're experiencing increased shedding and you regularly snack on large quantities of mixed nuts, a simple experiment is to scale back for 8 to 12 weeks and observe changes. Hair responses are delayed, so patience is key. When it comes to supporting hair health after 50, the goal is not to chase specific foods, but to create a nutritional pattern that supports the hair follicle over time. Nuts can be part of that pattern, but only when they're used intentionally and in balance. From a dermatologist perspective, the safest approach is rotation and portion control. Choose one type of nut at a time, use a small portion, roughly what fits in the palm of your hand, and rotate throughout the week. For example, almonds on one day, walnuts another, pistachios later in the week. This prevents overloading on any single fatty acid profile or trace mineral. Timing can also matter. Consuming nuts alongside protein and fiber, for example, with yogurt, vegetables, or a meal helps stabilize blood sugar and reduces the metabolic stress that can accompany fat-dense snacks eaten alone. Stable blood sugar is relevant because insulin spikes and resistance can influence androgen signaling, which affects hair follicles in genetically susceptible women. Another important point is to separate food from supplements. If you're taking a multivitamin or a hair supplement that contains selenium, zinc, or copper, be cautious with nuts that are high in those same minerals. More is not better. In fact, excess selenium and vitamin A are well-documented causes of hair loss. If you're unsure what's in your supplements, this is where label reading becomes important. It's also worth paying attention to your scalp. Hair shedding is often accompanied by subtle scalp symptoms, tenderness, burning, increased oiliness, or dryness. Have you noticed changes in your scalp comfort after dietary shifts? That feedback is valuable. The scalp is skin, and like all skin, it responds to inflammation, barrier disruption, and internal stressors. Importantly, nutrition is supportive care. If you're dealing with female pattern hair loss, telogen effluvium lasting longer than 6 months, or patchy hair loss, dietary changes alone are not sufficient. Evidence-based treatments like topical minoxidil and evaluation for iron deficiency, thyroid disease, or autoimmune conditions are often necessary. A dermatologist can help guide that workup. In terms of expectations, dietary adjustments take time. Hair follicles operate on a delayed timeline. If a change is helpful, you may notice reduced shedding after 3 to 4 months and visible density changes after 6 to 12 months. Consistency beats intensity every time. If you want one simple takeaway, use nuts as a supplement to a balanced diet, not the foundation of it. Focus on adequate protein, iron-rich foods if appropriate, omega-3 sources, fruits, vegetables, and whole grains. Nuts are accents, not the main event. Let's take a step back and revisit the idea we started with that certain nuts can regrow hair, while others should be completely avoided to prevent hair fall. What we know from dermatology and nutrition science is that this framing is too simplistic and in some cases misleading. Hair follicles don't respond to single foods in isolation. They respond to the environment we create for them hormonally, metabolically, and inflammatory wise. After 50, that environment changes. Estrogen declines, anagen phases shorten, and follicles become more sensitive to internal stress signals. Nutrition can support hair health, but it works quietly and gradually, not dramatically. The nuts we discussed as potentially supportive almonds, walnuts, Brazil nuts in very small amounts, and pistachios offer antioxidants, trace minerals, and fatty acids that can help reduce oxidative stress and inflammation around the follicle. They don't force hair to grow, they help maintain conditions that allow follicles to function more efficiently. On the other hand, peanuts, cashews, pine nuts, and excessive mixed nut consumption can in some individuals contribute to low-grade inflammation, fatty acid imbalance, or mineral excess when eaten frequently or in large quantities. This doesn't make them bad foods, it means they're not neutral for everyone, especially in the context of hormonal shifts and scalp sensitivity. One of the most important themes here is dose and balance. Hair follicles are sensitive to extremes. Too little nutrition can push hair into shedding, but so can excess, especially with minerals like selenium and vitamins like A. This is why more is not better and why supplementation without a clear indication can backfire. Another key point is that hair loss is often delayed. If something in your diet is contributing to shedding, the effects may not show up for months. That's why slow, consistent changes rather than dramatic eliminations are more useful and sustainable. I also want to emphasize what nutrition cannot do. Diet alone does not reverse genetic hair loss, scarring alopecia, or untreated medical conditions. If you're experiencing ongoing shedding, widening of the part, or thinning at the crown, it's important to talk with a dermatologist. Evidence-based treatments and appropriate lab evaluation are often part of the solution. If there's one simple, low-risk habit you can start today, it's this: be intentional with nuts. Choose one type at a time, keep portions modest, rotate throughout the week, and pay attention to how your scalp and hair respond over several months. Combine that with adequate protein, gentle scalp care, and realistic expectations. Healthy hair is not about chasing trends or superfoods. It's about respecting the biology of the hair follicle and supporting it over time with consistent, evidence-based care. If you found this helpful, give the video a thumbs up, share it with someone who might benefit, and subscribe for more evidence-based skincare education. I'll see you in the next one.